This is a video demonstrating simple knee rolls to help support your low back and bring a little bit of mobility into the lumbar spine. Laying on your back with your knees bent and feet flat to the floor, bring your knees together and maybe your big toe mounds. Have your arms down by your side and take a couple of breaths. The breaths are important to start to engage through your lower abdomen and the muscles in the deep abdominals. So as you breathe out, see if you can sense a little tightening across, as though you had a low slung belt across your lower abdomen. You breathe in, there's a sense of expanding into your rib cage, and as you breathe out, just see if you can find a drawing in, a gathering through the abdominal area. So trying to keep that breath nice and smooth. And then on your next exhale, roll your knees over towards the right. So I'm keeping my shins connected as I take my knees over. My left shoulder stays connected down towards the ground, and I'm only taking my knees so far that I'm not coming into any pain in the lower back. You breathe in, and as you breathe out, bring the knees back through centre. So the feet will come flat down onto the ground. You'll still have your thighs together, your shins together. Another breath in. On the breath out, take your knees over towards the left. Now, as you take your knees over, you might notice on the video that my opposite foot is lifting away from the mat, and that's because I'm keeping my knees and feet really firmly glued together, and this helps a little bit more rotation into the pelvis. Again, knees to the left, the right shoulder, the opposite shoulder will stay connected down towards the ground. You breathe in that position, and as you breathe out, you come back through centre. So I'm moving very, very slowly. You could speed this up a little bit, but sometimes when you're in an acute stage or very painful through the lower back, it's really important that you move with awareness, not pushing yourself through into deeper pain or straining at all. So you roll to the left and the right. Trying to move on your exhale when you have a sense of engagement through your core muscles, your deep abdominals. Coming up through centre. Breath in, breath out. Rolling over towards the right. Breath in, a breath out, holding that tone through the lower belly to come back through centre. Breath in, breath out, roll over towards the left. Breath in to hold, and a breath out to come back through centre. So this movement brings rotation in around the waist, and this is where our lumbar spine is, to start to mobilise and start to get rotation between the vertebral joints. It really is important that you don't push or twist or try to force the knees down towards the floor, or if you're laying in bed, down towards the bed. So keep this movement. Think about a real softness and a gentle movement, and particularly if you're suffering from sciatic pain or radicular pain, these gentle movements should just help when our muscles go into a lot of spasm because of that intensity of the pain that you're feeling.